for tuning in to another episode of Disrupt Health Tech. I am your host, Wendy Austin, and today we're going to talk about the way health plans are adapting to digital health offerings and point solutions. With me today is Claudia Kraut, the founder of HealthGTM. Welcome, Claudia, to Disrupt Health Tech.
Hi, Wendy. Glad to be here.
Thank you. Today, we're going to talk about the evolving world of digital health as an offering of health plans. You have a long background in the area of health plans and employee benefits. Would you like to tell our viewers about your background?
Absolutely. So I started out on the health plan side many years ago, working for several of the major health plan payers in the country. And I did kind of everything you can do in that arena without being an underwriter. So I worked in marketing and I worked in product development. I worked in commercial plans, Medicare, Medicaid. I even did some advertising. I produced an ad that played during the Super Bowl at my local market, in fact, which was one of the most exciting highlights of the career. And then in about the 2010s, went into digital health, working at a company called Amwell, which is one of the leading telehealth carriers. Yeah. And from there went into digital therapeutics. And in those past, kind of 10, 12 years, I've really worked in a distribution leadership role, coming up with channel partnerships, establishing consulting relations divisions. So really a go-to-market focus, looking at the digital health landscape, the various ways that we are now delivering care using technology.
Right. Very good. So what are some of the trends that you've seen over your career relative to health plans and employers and how to bring to market those digital health offerings?
It's been really interesting. You kind of see pendulum swings in everything. So there was a time, kind of when I started in the space many years ago, that health plans offered everything. Yeah. Everything was found in your health plan. And then there was a kind of a feeling that maybe jack of all trades, master of none, that there should be cleaner expertise in a particular area. And so different point solutions started to pop up. And at about, I'm going to say, it's weird to say the turn of the century, but as we hit about 2000, you started to see hub solutions evolve, some way for health plans to understand all of the solutions that they were offering and help people navigate to that. So you had in sort of, 1999, 2000, you had Quantum. 5 or so years later, you had Castlight and Jiff and eVive that were kind of digital front doors or hub and spokes models to try to direct people to the right services. Around that same time, you also started to see telehealth arise, right? We're starting to really lean into technology in about 2000, 2005. So Teladoc and Amwell and MD Live and Doctor on Demand, and those all happened in the first 10 years of the 2000s. And then when you hit about 10 years, there was this major sprint in growth and development of digital solutions that are really addressing specific healthcare issues. So now health plans are seeing that their care management function is being mirrored on the outside digitally with things like Omada and Livongo and Hello Heart in the cardiometabolic area. You started to have, musculoskeletal solutions in about those mid, kind of the 2010s. You started to have fertility solutions like Kindbody and Ovia and Progeny. And now you're really moving toward gut health and things like that. So that, and of course, thank goodness, just before COVID, when we all desperately needed to access mental health care remotely, that's when you started to see the advent of some of these mental health solutions. I mean, Lyra was about 2015, Spring was about 2019. So you really started to see, mental health care arise. And, then I think we're going to talk about this in a minute, but just to kind of foreshadow, you then really started to see, again, this proliferation of solutions and a struggle for how to rationalize that. So, how it all had come from the health plan, then it all kind of went out into the market. And now we're sort of trying to figure out, again, how do you put these things in one place so that they're visible and accessible and rational and navigable to the consumer?
Yeah. So what do you think will happen with telehealth and telemedicine offerings as it relates to health plans in the future?
I think they're a must-have. I think they used to be a nice-to-have, and I think they are a must-have. there was a moment in time, again, in kind of the late 2010s, when health plans were looking to either build their own proprietary telehealth platform, or they would lease a proprietary telehealth platform from one of the major technology platforms. But since then, there's been such an abundance of small telehealth solutions. There are digital therapeutics that are coming in with their own native, or they're, kind of leasing from someone else. There's such a selection available that I think the idea of a health plan making a massive investment in building its own telehealth platform is going away. They need to have telehealth available. They do not need to offer their own proprietary solution. So they need to be able to refer members off to the platform that relates to the care that they're seeking, or they need to be able to, kind of be interoperable with whatever other platform is available. So there's more coordination and less ownership of it. But they do need to find, one of the things they're struggling with and will continue to struggle with, I think, is finding a single point of entry, finding a single unifying platform so that people can take advantage of all of these different ways to enter, all these different options in the system, but can they enter through one place? One of the great challenges is, how do we convey benefit literacy so that people know what's available to them and know how to reach it? It's definitely there. Anything you could imagine now exists in the system. And the challenge is, how do we get to it?
Yeah, exactly. So let's talk about point solutions. There's been some talk about point solution fatigue. And when it comes to the benefits that employers offer their employees, can you kind of give a brief description of what point solution fatigue is and what you're seeing health plans do about it?
Sure. I mean, and that's, absolutely great segue from what we were just talking about, this idea that there's a solution for everything, right? And the challenge is this overabundance.
Yes.
This overabundance of solutions. There are several, cardiometabolic, there are dozens of cardiometabolic solutions, and there is a solution for virtually every health issue that you can have. There are several different kinds, and there are several different different levels of acuity are addressed. If you're in the mental health system, you can go from mindfulness and meditation solutions to, video care, to chat only, to video plus in-person, to navigation to the level of care, all the way through to, inpatient and outpatient and everything in between. So the overabundance is sort of challenging. And oftentimes, yes, the health plan is coordinating a lot of that care. They're certainly coordinating the payment for benefits, but for many employers and self-insured employers in particular, the employer is selecting the point solutions. The employer is dictating the benefit configuration and often selecting the areas of care to address. And there have been trends. Right. Everything has a trend line. Right. And we talked just at the top of this, right? We talked about, there were the cardiometabolic solutions, and there were the fertility solutions, and there were the mental health solutions, and there were the gut solutions. And so everything has kind of had its time. And these solutions have sold typically through consulting firms to the employer, or through the health plan to the employer, or all three at once. It's kind of three levers, right? You have to, they need to be selling to the health plan and the consultant and the employer at the same time. Any one of them might be the buyer, but at least each buyer needs to know that the other two entities in that solution understand what's happening. You buy the new thing. It's like when you buy a new pair of socks. Did you throw out an old pair of socks, or do you have a drawer that is increasingly overflowing with socks? They've got the overflowing sock drawer. That's what's happening, right? Is point solution fatigue is, I've contracted with 16 different point solutions,
and
I can't organize them. My
Right.
people don't know where to go.
Right.
And I don't know which one is impacting my trend line. I
Right.
can't tell. I have too many of them right now. And, so point solution fatigue is sort of the employer or the health plan, whichever is the payer and the administrator of these things, trying to figure out, what do I really have? Which is doing my people any good?
Yeah.
How do I administer them? I have too many client success teams trying to talk to me. How am I paying these bills? Which one is impacting? So it's all of that sort of thinking around, I've got too many socks in the drawer,
Yeah.
and I don't know which one is doing me any good.
Yeah.
That's and of course, from the user standpoint, same thing. My employer has offered me benefits. I know there are a lot of them. I'm not really sure which one I need, or I'm
Right.
not sure where to access them, or oh, I have 3 different problems, right? If you have one chronic disease, you probably have
Right. Yeah.
I don't know which one to go to. And if I'm
Yeah.
going to all of them, that's a lot.
Yeah.
So
Yeah.
that's really point solution fatigue, is this sort of overabundance of riches
Yeah.
in the system, and trying to understand how to use it, how to administer it, and what is offering optimal value.
Yeah. Do you think that we'll continue to see employers pay for all these multiple point solutions? We've talked about the gut health and the diabetes apps and the sleep apps. Um, do you see them as paying for multiple of these, or looking for a package to incorporate them into the health plan in some way?
Yeah, it's a great question. And if I look into my crystal ball, I don't see them going away anytime soon, right? These digital solutions are here.
Yeah.
Several of them, we're at 20 years of tenure now for some of them,
Yeah.
and they're
Yeah.
accelerating all the time. And there was a recent study from Deloitte that said 25% of health plan profits are coming from digital health contracts with digital innovators.
Oh, wow.
So yeah, so if health plans are making money at these contracts, either because they're selling them and pricing them really well, or because these solutions are really lowering the claims outflow, or both, right? Ideally, they're not going away. We're
Right.
also seeing, in the past couple of years, the arrival of digital first payers, digital first
Oh,
health plans. You've got Centivo, you've got Firefly, right? You've got health plans that are jumping in with both feet and realizing that there's no turning back from the technology. So the thing that they're looking at is, how do we improve adoption of this from the employer's standpoint and the employee standpoint, so that people come into these digital first solutions, or these digitally rich solutions,
yeah.
and how do we allocate them and navigate them rationally?
Yeah.
So I think they're not going anywhere. What employers are going to look for, again, is evidence that people are engaging,
Yeah.
right? What are I mean, certainly they're going to look for a good price point, and they're going to more and more look for simple administration,
Yeah.
right?
Yeah.
How can you reduce the burden of offering your solution? How can you reduce the burden of offering your solution in context of my other dozen solution partners?
Right.
Right. That's going to be important. Can you consolidate the administration? Is there some way that you can all appear on a single bill, or that you can all appear in single reporting? Nobody's really doing that yet. And I think employers and payers would really like that. They are going to look for, how are you ensuring that you're engaging my members? How do I
Yeah.
ensure that you're being used, so that any of this is a well amortized expense over the population? They're going to look for evidence of outcomes. So there are some solutions that come in with outcomes pricing. The interesting thing there is, a lot more solutions offer outcomes pricing than there are, I think, buyers who take that on, because while it's philosophically in line with what the employer is looking for, the truth is there's no budget certainty there.
Yeah.
And you have that imperative. They're going to look for a real return on investment. So can you really prove to me, not hypothetically, that every dollar I've spent on your solution is giving me $1.50, $2, $3 returned in what? Lower claims cost, increased productivity, lower employee turnover, whatever that metric is. That's, I think, what employers are going to continue to look for, and health plans are going to continue to look for. Health plans also, in partnering with these solutions, are going to look for marketing partners, right? If I'm going to contract with you and I'm going to white label you, or I'm going to promote you under your own label, how are you going to help me pay for those marketing costs? And are you going to help me kind of, again, what's the ROI? Are you reducing claim spend? Are you helping me retain customers? How is that going to look? But they absolutely are not going to cut off digital solutions. There's kind of no turning back the clock on that. We're very much moving forward.
All right. So we talked about the fascinating dichotomy of high-tech offerings corresponding with a national level of attention to basics, including functional health and the gut. Can you explain how that dichotomy is impacting what employers and health plans offer?
Yeah, I mean, I think that it is really interesting that there's so much more attention now to functional health, gut health, the gut microbiome. It's the gut microbiome more and more and more is being identified as the second brain, in that it not only manages so many of your unconscious functions and your automatic functions, of overall health, your cardiometabolic health, your heart, your musculoskeletal. It also really impacts your mental health. If your gut microbiome is off, it will increase your depression. It will increase your cortisol and stress levels. There's a lot going on with that. So it's kind of neat. What's happening is there are a number of solutions that have arisen to make testing for digestive health easier, right? There are home tests you can do. There are blood tests. I think there's some saliva tests. There are certainly some excretory tests, shall we say, where you mail something off, and you can get a very, very, very good read on people's gut microbiome, and that can help to drive some of the treatment plans on a variety of ailments that you wouldn't necessarily think of as related to digestive health, but that whole functional health piece. And it's going to get even more attention with changes in government staffing. There's a lot more attention right now, with the health agencies to nutrition. And there's so much more being said. And Dr. Mark Hyman is one of my personal heroes. He talks about ultra-processed foods and the dangers of ultra-processed foods and the additives, the colors, the emulsifiers, right? All of these, the preservatives, things that are in here that have no business being in our food, and how that impacts our overall health. And then, so you have these sort of digital gut health solutions, Good Path, Digby, Cylinder, that are out there talking about, we're going to work with your stomach. We're going to work with your food. We're going to work with your gut health. And by doing that, we are going to work on long COVID. We are going to work on musculoskeletal pain. We are going to work on cholesterol. We are going to work on depression, like all of these things that you might not have thought about. And some of that, the solution is really about getting back to functional health, to gut health, to balancing out your diet, to sort of going truly back to basics, meaning eat food that came out of the earth, right? Is better for you than food that came out of a foil bag. And I think that is something that health plans are grappling with. I mean, it has been true for a while now that Medicaid will reimburse for healthy food. There are programs that allow physicians to prescribe organic vegetables. And there are services that will fulfill those prescriptions. And there are farmers markets that will provide discounts if you come in with that prescription. I think that's been going on for about a decade now, but it's starting to take on a little more momentum. I personally feel that's a really good thing.
Yeah. It's interesting. I'll have to see. I actually have a CSA that I get every year, community supported agriculture from my local farmer here. So that's very interesting.
I applaud that. I think that's one of the best things you can do for your health, truly, is to just find the local producers of fruits and vegetables,
Yeah.
meats. Eat from that. Eat from something that hasn't. Spinach loses most of its nutrients in the first 3 days after picking.
Oh,
How
yeah.
many of us going to a major supermarket chain are buying day and a half old spinach?
Yeah. Yeah. Yeah.
Not so many, right? So you are absolutely on track, Wendy. That is what, going to a CSA is really one of the easiest insurance policies you can buy for yourself.
Yeah. Very good. All right. So let's switch gears now and discuss your company, HealthGTM. Do you mind telling us what your main focus is at HealthGTM?
Be delighted. I love HealthGTM. What I did a little while back was I took all of that experience we talked about at the very beginning, right? 15 years in health plans and 15 years in digital therapeutic solutions, and understanding the payer mentality, what they're looking for, understanding go-to-market strategies, and working with strategic partnerships and channel partnerships. And I started to work with up and coming health tech firms, anything with a health and technology nexus. So it can be digital therapeutics, actual care delivery. It can be healthcare payments. It can be mental health. It can be musculoskeletal health. It can be substance abuse orders, all of these things. And all of those include clients I'm currently working with. I always look for a client that truly has a product in market. I'm not at the sort of, seed stage where they're just coming up with the concept, but really a product in market. And typically they're over concentrated in a single market space, and they're looking to de-risk that strategy by going to new markets. And I will help them understand, for example, if they've been direct to consumer, what is the group venue that is most appropriate for you. Sometimes it is employer markets through consultants or to health plans. Sometimes it's not. Sometimes there's a wonderful corollary. Sometimes there's another company, another market that is selling to your ideal customer profile, and we'll partner in there or sell through there. So I've done a bit of that. And I love to work with companies actually that are already sort of in the, Series B, we'll call it. It's kind of size, and they're doing a lot, but they've got an awful lot of competition, right? If you're that big, probably the market is developed, and they're trying to figure out creative ways to grow. And I usually try to understand with them what's the race? Where is everybody running? And I go over to the lane over here, right? Take them kind of one step to the side, get a little creative about going to market, and have had some really tremendous success taking companies into new market spaces, new customer populations, and really driving a lot of revenue and sort of, helping them recontemplate the best way to grow their business. They're usually quite innovative. I love to choose companies that have something unique. They really have an interesting value prop. They're either approaching it from a very different perspective, or there's something about it that just simplifies it for the user, or just simplifies it for the payer, or is, just a bit more effective. And I love it when it's a bit more, integrative, right? There's, if you're going to do something without if they're taking the time to notice that there is benefits through, for example, adding a dietitian to a CGM program, so that you're not just giving someone data, you're interpreting the data with them. You're helping them understand what actionable things they can do to help improve. I love working with that.
Yeah, great. Perfect. So what's next for HealthGTM?
I'm continuing to grow. I get new clients all the time. I try never to work with two clients in the same space at one time, and juggling that nicely. I'm excited about continuing to work with larger firms and then balancing that with a couple of startups. I do have a few true startups because I like to help increase innovation in the marketplace. I'm interested in getting more into sort of food as medicine. I'm a big proponent of the idea that the closer it is to the way nature put it on the planet, the better it is for you. So I'm interested to watch that space and to sort of become more involved in the changes in the market and in regulation around food as medicine and moving away from ultra processed items. I mean, I shudder to think that 70% of our diet is comprised of something that the manufacturers themselves don't even call food. They call it consumer packaged goods.
Oh yeah. Yeah. Interesting. Yeah.
Yeah, that's just right. So I am on a mission to help health tech innovators grow their companies, and I am on a mission as well to try to promote those health tech innovators who are also doing some good for the planet and the world. I think that's that's
Very
right.
nice. With both your past experience and your current experience with HealthGTM, what do you think healthcare's greatest challenge is in the future?
Oh, that's such a loaded question. I think the greatest challenge is going to be navigating the changing tides of regulation that are coming over the next couple of years. I think a challenge is going to be trying to figure out what to do with AI.
Yeah.
Everybody's integrating it into their products and their programs and their worlds and their lives. And so how can we do that in a way that isn't just jumping on the bandwagon of the cool new thing, but actually deploying it to be truly helpful, and how to partner? And I think this has always been the big challenge and continues to be the big challenge. How do you partner the technology with the human being on the other end of it and ask that human being to make changes? Because if we are to truly improve the health of this nation, it won't be just through more meds, more dollars. It's going to be asking people to change things. And so marrying the tech to the very real challenge of making human change, I think is going to be the nut to crack. Always has been, always will.
Yeah. Thank you so much for your time today, Claudia. I really enjoyed diving into the past, the current, and the future of digital health offerings and health plans. For more information about either Disrupt Health Tech or HealthGTM, please see the links below. And thank you so much for attending today's session, and see you next episode.